ECG explained what that squiggle really says. A strip of paper slides out of the machine, covered in a jagged, restless line. The doctor glances at it and says, "Your ECG looks fine," and you feel relieved. But should you? Here in India, heart trouble tends to arrive early, often a decade sooner than in the West, and not always with the chest-clutching drama you'd expect. Here's what most people get wrong. An ECG is not a verdict on your heart. It's a 10-second snapshot of one single thing, your heart's electricity. So let's read it together, calmly, what it can tell you and what it cannot. First, what is an ECG actually recording? Your heart runs on electricity. Before every beat, a tiny electrical spark sweeps across it and tells the muscle to squeeze. An ECG is simply a recording of that spark. Sticky pads on your skin listen in, usually from 12 different angles, for about 10 seconds, and draw the signal as that familiar wavy line. So notice what it is and what it isn't. It's reading the heart's electrical rhythm, not blood flow, not how strongly it pumps, not the arteries. It reads the wiring, not the plumbing. So what is the doctor reading in that line? Each heartbeat draws the same little shape in 3 parts. First, a small bump, the P wave, as the top chambers wake up. Then, a tall sharp spike, the QRS, as the main pumping chambers fire and push blood out to your body. Then a gentler T wave, as the heart quietly resets its electricity for the next beat. Your doctor checks how fast they come, how regular they are, and the exact shape, especially the short stretch just after the spike, called the ST segment, and that T wave. Because that's the part of the line that changes when heart muscle is being starved of blood. And there are 2 things. An ECG is brilliant, genuinely life-saving. The first is rhythm. If your heart is beating chaotically, most often from atrial fibrillation, the ECG catches it instantly. The line turns irregular, and that small P wave vanishes. That matters, because an untreated chaotic rhythm quietly raises your risk of a stroke. The second is a heart attack happening right now. When a major artery is completely blocked, the ST segment lifts up off the baseline in a telltale pattern, and that one finding sets off an emergency response to reopen the artery fast. When minutes decide how much heart muscle survives, this 10-second test is one of the most powerful tools in medicine. But, and this is the heart of the whole video, a normal ECG does not clear your heart. At rest, narrowed arteries often cause no electrical change at all. So, about half of people with seriously blocked arteries have a completely normal, resting ECG. And even during a heart attack, about 1 in 20 looks normal on the very first trace, and many never produce that dramatic lift at all. The signs are subtle, or they appear only on a second ECG, an hour later. So, if you have warning symptoms, a reassuring ECG is not a green light to go home. That's exactly why, in hospital, they repeat it and add a blood test we'll come to. Why am I, as a doctor in India, so insistent on this? Because of how heart disease behaves here. South Asians tend to develop it earlier, often around a decade sooner, and frequently at a lower body weight, that thin but unhealthy pattern. And it doesn't always announce itself with classic chest pain. In women, in older people, and especially in anyone living with diabetes, a heart attack can be quiet. Just breathlessness, a heavy jaw, sudden exhaustion, a cold sweat. Diabetes can even dull the very pain that's meant to warn you. So we can't sit back and wait for a textbook symptom, or rest the whole decision on one calm-looking strip of paper. Now the flip side, which causes just as much needless worry. An abnormal-looking ECG is not automatically bad news. Plenty of perfectly healthy hearts draw unusual lines. In many young fit men, a little extra lift early in the trace. Doctors call it early repolarization, is simply normal. An athlete's heart, or a pattern someone has carried unchanged since childhood, can look alarming and mean nothing. And the machine prints its own guess at the top of your ECG. An automatic reading that's wrong surprisingly often, overcalling problems that aren't there. So an odd squiggle is a question, not a sentence. It tells your doctor where to look next. Read alongside you, never instead of you. So, if an ECG can't do everything, what fills the gaps? Quite a lot, actually. And that's reassuring, not frightening. To see the heart structure, its size, its pumping strength, its valves, you need an echo, an ultrasound of the heart. To see the arteries themselves and exactly where they are narrowed, you need an angiogram. To catch trouble that only shows up when you exert yourself, there's a stress test. And to catch a rhythm that comes and goes, there are longer recordings. The ECG was never meant to stand alone, is the opening line of the story, not the whole book. So the smart question isn't only whether to do an ECG, it's which kind. If the worry is happening right now, the standard 12-lead ECG in the clinic is exactly right. If your symptoms come on only when you climb stairs or exercise, a stress, ECG watches your heart while it works. And if your trouble comes and goes, a flutter you feel some evenings, but not others, a single 10-second test will almost always miss it. For that, your doctor sends you home wearing a small recorder for a day or more, a Holter monitor, to catch the heartbeat in the act. And if you take just one thing from all of this, let it be this. An ECG is not a verdict stamped onto your heart. It's a 10-second reading of your heart's electricity. One piece of information. Read in the context of you. No fear. Just the why. So let's lay it out plainly what this test catches and what it can quietly miss. It catches a chaotic rhythm like atrial fibrillation while it's actually happening. A major heart attack in progress, the scar of an old one, a heart muscle thickened by years of high blood pressure, and certain dangerous electrical faults that can cause blackouts. It can miss a heart between episodes when everything looks calm, stable, narrowed arteries that haven't yet declared themselves, the valves and the pumping strength, and the arteries themselves. Hold both columns in your head at once, and you'll never read a frightening line or overtrust a calm one. Which brings us to the watch on your wrist. Many smartwatches now take a single lead ECG. And honestly, for one job, they're genuinely useful, nudging you that your rhythm might be atrial fibrillation, so you can get it properly checked. But know the limits. It's listening from just one angle, not 12. It cannot detect a heart attack full stop. And it cries, "Wolf!" Many of its alarms turn out not to be a real problem at all, which can leave you anxious over nothing. So treat a watch alert as a prompt to see a doctor. Never as a diagnosis and never as a reason to talk yourself out of getting chest pain checked. And that is the line that matters most. So let me say it plainly. New chest pain or pressure, sudden breathlessness, fainting, a cold sweat, especially if it's unusual for you, or you live with diabetes, high blood pressure, or a family history, is an emergency. Call 108 or 112 or get to a hospital straight away. Don't drive yourself. Don't wait for it to pass. And don't let a calm smartwatch or a quick ECG that looked fine talk you into going home. In hospital, they'll repeat the ECG over time and add a blood test called troponin, which rises when heart muscle is being damaged. Is that combination, repeated together, that truly catches a heart attack. So, the whole thing in one breath. An ECG is a 10-second snapshot of your heart's electricity. It's brilliant at two things, catching a dangerous rhythm and catching a heart attack in progress. But a normal ECG does not clear your heart. About half of serious blockages hide behind a normal trace. An abnormal squiggle is a question, not a diagnosis. And it is always read together with your symptoms, a blood test, and sometimes a scan. If you'd like all of that on one clean page, what each part means, and the exact questions to ask your doctor, just comment the word honest, and I'll send you the free one-page guide for this video. If this made the squiggle on that little paper feel a lot less frightening, subscribe. Because that is the whole point of this channel. We take the things that scare you in a medical report and we make them make sense. Sushruti, worth knowing. One last thing, and it matters. This video is general information, not medical advice, and it isn't a substitute for your own doctor. An ECG only means something when it's read alongside your symptoms, your history, and your other tests. If something is affecting how you feel, and above all, if you have chest pain or you sense that something is seriously wrong, please don't wait. See a qualified professional or call your emergency number.